lockdown 3.0, a few things have become clear. India, very luckily, and because of forward planning and some vision, has managed to, so far, escape the brunt of the COVID-19 pandemic. Our numbers are relatively fewer, even of those who have succumbed to the disease. But we still don't know what comes ahead. Today, I have with me the India representative of the World Health Organization, Dr. Henk Bekedam, who's joining us on the show. Dr. Henk, thank you so much for speaking with us on ET Now today. And let me begin straight off by just getting your take on India's specific battle with the COVID-19. We started off relatively earlier when we had very few cases, have one of the most stringent lockdown across the world. Do you think in light of that, and that is one of the reasons why we have seen relatively few numbers?
I think I would agree with this. I think what has been very good from India took it very seriously from the onset. And what do I mean by this? When I returned early January from my home leave, when I met with the Secretary of Health, then I think within days, I think she was talking to all the states and making sure that the states understood that something is coming and we better get ready. Actually, at the end of that same week, the Prime Minister's office got involved and helped with the coordination and made sure that it was not only seen as a health response, but also as an all-government response. So in that sense, I think we have been very fortunate how seriously India took it from the beginning. And we really think that that has helped to flatten the curve from the onset, because there are also a lot of bold interventions at the early onset of an outbreak. You know what happened with an outbreak? If you start dealing with the issues at the early onset of the outbreak, that's the best time that you can fight it. That's the best time that you can prevent spreading it. And I think in that sense, I think we had a very good start here in India.
So today we're wondering, and a lot of people watching this must be wondering, how long do you have to take these kinds of precautions? There is no real clarity on when a cure or a vaccine for COVID-19 would be available to the general public. Before that, is this the only way to continue in this very stringent lockdown?
No, I don't think so. And I think what we've also seen, and today is a very special day. It's lockdown 3.0, what you said in your introduction. And what you've seen from the lockdown, I see a lot of things that makes me quite pleased in how India is approaching it. It's focusing on containment, because that still remains the issue. And I think, first of all, I would like even to expand a little bit from why this first period was so important. India, in that whole period, was also trying to get its systems ready. It started testing more, and I think at this very moment we have already that on a day, India is testing more than 75,000. And testing is a very important part of the other system, what we call surveillance. Surveillance and testing, this has to go together. So the surveying and the testing, I think India...
I've lost the line there.
It also started preparing the hospitals. So in that sense, I think that period was very important to get to take this time to make sure that the overall system is ready. Now, what today also is happening is this whole concept about the red, the orange, and the green district, but together with the containment zones. And the containment zones is actually the most important part. This is focusing again from whatever comes to us, we need to make sure, even when there are few new cases in a district, India is calling it a containment zone. Because what is important when you have a new case, that you start doing the contact tracing. You find out from who has the person been in touch with who was positive. Then you do the isolation. Because the isolation part is actually more important than any other disease. If I compare it with the SARS in 2003, people were very clearly ill. And people were only spreading the disease when they had a fever. Now that is different with this new coronavirus. And therefore the contact tracing and the isolation is an extremely important concept. So the whole concept about a containment zone, and then containment zone being again in the red districts, where there's still limitation of movement, but also, and I think that you are alluding to, already opening up as well. I am very pleased now that next to where I live, that the A block market, that the shops are open. I think that's very important. And it's still in a very responsible way, I think it has been done. And the whole concept, again, from those districts who had no cases for the last weeks, that they at least can go even for a bigger step, while we're still in the overall containment, that limitation of overall travel between states, etc. So in that sense, I think also the focus on the containment, that remains the key. Whatever will come next, we indeed don't know. But one thing we need to make sure that if cases are coming, that you are really focusing on the containment of every single case. We know from India and we know from the world that every single case can become a cluster. And the only way we're dealing with this is detecting it early and doing the contact tracing and isolation, etc.
Yes. Okay, I want to get your take, Dr. Henk, on where we stand in terms of cures and even vaccines. There are, we reached the stage of human trials very quickly in many parts of the world. In terms of cures, the drug remdesivir is being touted as, having made some breakthrough. Is there any clarity on this, on what actually works right now?
Not yet fully, but at least are very promising. When you have a new disease, there are a few things that we need to say from the onset. We are all learning. And what I said in the first week when I came back to the Ministry of Health, I said, we are sailing a ship while we are building it. And I think that is very important. And what are some of the tools that we're using? The tools that in order to deal better with this outbreak and with disease in general is that threefold. It's about diagnostics, it's about medicines, and about vaccines. Now, on the diagnostics, I think they have already made some improvements, but you've recently also seen that some of the diagnostics were not yet good enough. And some of them were working perhaps in one country, but they were not working in another. So we need still to get the diagnostics also further being improved. And on the medicines, I think last week I would agree from what we heard is that at least it seems to be a medicine which at this very moment is able to influence the outcome, or at least it was able to get people earlier released and cured, etc. But it's too early to say, because and I think in that sense it's also very important. Like in WHO, what we do is solidarity trial. And what is very important when you build up evidence is that you need to have the right numbers. And therefore we're very pleased as well and enthusiastic that also a country like India has joined the solidarity trial. If you do research and you have evidence for 100 people, that gives you a certain confidence about if something is working or not. But if you are able to combine the same protocols over many countries and you look at 10,000, then at least the evidence will be a lot more stronger and will help us to guide. So we're very pleased on this area. Although it looks very promising, it's too early to say that this will really be the cure for the disease. The same thing is with the vaccines. At this very moment, there are 89 vaccines are globally in development. 7 to 8 are already in the clinical trial part. Now, what is very important again, let's combine, let's make sure that we understand from what's happening and let's learn from each other. And by the way, in the vaccine part, there are two components what's important. One is, first of all, detecting a very effective vaccines, a vaccine that normally takes quite some time. I think normally we even talk about years. But this time I think we hope with this joint effort that we talk about 12 to 8 months.
Yes.
And then it's still very important that we find this effective vaccine. The second component will be is very important. We need to make it, scaling it up from the vaccines itself. If tomorrow we will be able to find that vaccine, then still all of the world, 7 billion plus people, they need a vaccine. So we need to start producing the vaccine. Here I'm very proud of India. India, as the pharmacy of the world, has a very important role to play on both ends. One, in the research itself to look for effective vaccine, but also in the scale-up when we once will find it. And I think there are institutions here in India, and including also the NIV Pune, who are already in that game now. Because what is important, of course, at the moment that you have it, everybody wants to have it. And therefore, we're looking at a country like India, not only to start producing a vaccine for its own population, but even start supporting the world.
Fabulous. I just want to get your take, Dr. Henk, on a couple of things, because there are so many theories floating around. Is there any real solid link between the BCG vaccine that a lot of South Asians and all Indians get when they're very young, and the rate of the COVID-19 hitting us. Do you think that's one of the reasons why the numbers may have been relatively low?
As of now, we cannot yet say it. But what is happening, and that is very important, again, there are some trials going on in this specific area. And I think it is very important that all that information is coming together. And if I look at this very moment that on the BCG and also on the other component that you just were mentioning, there are now some trials going on. And I'm hope that it will be very hopeful. But at this time moment, we cannot yet say that it has any strong evidence as of yet. But I'm very happy that at least these trials are there, and we hope to learn from it as soon as possible. And that's also one part where I think as WHO we are contributing. We know that in globally there's some of these trials are going on, and that information needs to be gathered, and whatever new information we have, we need to share. Think about that ship that we are building. That ship will be built, and as soon as we know that something is there, then we need to make sure that we share the information to all countries to make sure that everybody can benefit.
And what about plasma theory and the plasma therapy? Taking plasma from those who have recovered and using it to treat those who are now currently suffering. There have been some early successes reported by some state governments within India. Do you think this could be a way forward?
Now, the plasma was indeed something what was also done during the SARS. And the SARS was the disease in 2003 and has also been used by the disease MERS. And there were quite a few positive things coming up that people were earlier recovering, and especially those ones who were severely ill. But here again, I would also still have a caution. We are still not yet there. We're gathering the evidence. And again, India is also part of building that evidence. So this is happening now in several countries, and we need to look at the data. Whatever you do also with plasma, you need to make sure that you do it also in a very safe manner. So there are a few aspects about it. It's again part of a clinical trial, and we hope to learn from this. But I'm very happy that you're already thinking about these solutions, because I was also very pleased when last week we had at least evidence that a medicine was influencing the reproduction of the virus itself. Even then, we don't know if it's yet a full cure, but this is very important. I was very encouraged, and I think we should also be very encouraged that on the vaccine part, it will be a very important part to start making sure that we can do something about this outbreak. If we that will be extremely important to influence the way this outbreak is going.
I just have to wrap up by asking you, Dr. Henk, about the bad rap that the World Health Organization has got recently from some world leaders, most prominent among them, US President Donald Trump. The World Health Organization has been accused of backing China, of not being quick enough to declare COVID-19 as a global pandemic, of not giving the right information on time. Do you think that this criticism, any of it is valid? And why do you think you're seeing this kind of a tirade right now?
Now, I think it is very important that we also stay focused what needs to be done. But I think on the early reporting, I think it was reported by China on the 31st of December. And just like here in India, you will hear the minister saying, and the secretary, they were already on the case on the 7th and the 8th of January. We were already sitting together. And I think that included also with WHO. We were there at meetings and we were advising. We were making sure that everybody understood that this could be a potential threat. And that is very important from that we are now focusing also what needs to be done. And because this is such a big threat, and look at how it's been influencing our life. This is now far much more than just a disease. I was very fortunate. I was a WHO representative at that time in China, and we were able to put that virus back into the bottle. Yeah, there's not a threat anymore for humankind. Now, unfortunately, this disease will be with us for quite some time, unless we're finding a medicine that can cure, unless we will find a vaccine. So now we need to make sure that we are focusing on the job itself. We need to make sure that we are working together with governments, that we are gathering evidence, which will be guiding our process. And that's why I'm so enthusiastic also from what India is doing about the containment zones, the red and the orange and the green districts. A very clear concept about the containment. That will be the focus, and that will be the focus also for WHO for the months and years to come.
Okay. Thank you so much, Dr. Henk, for speaking with us today and taking all of our questions.
Thank you very much. Nice speaking to you. Thank you.